So I almost made a mistake back in 2018 that I can't even imagine I wanted to make that mistake, and recently people have been asking me questions based on that. Hello guys, welcome back to my YouTube channel. My name is Cynthia, and if you're seeing me for the first time, you're welcome to this channel. And today I'll be talking about an experience that I went through back in 2018 before coming to the UK. So without wasting much of your time, let's dive into the video. So this video is specifically about nurses, and especially those nurses who might want to work in the UK and are quite confused about where to work, if to work in a hospital or to work in the care home. So before I came back in 2018, I had this hard nut to crack. I had to choose between going to the hospital or working in the care home setting or all of that. And some people make it so confusing for other people, especially people migrating from other countries. The problem comes when they don't really know what is expected to do in each setting. So some of them wants to go to the hospital because of one reason or the other, but then they're not quite sure if they're making the right decision. First of all, people might want to choose an employer based on the pay, the remuneration. That is the main thing people look at. That's the main consideration we look at before we choose whether to work in the care home or to work in the hospital. However, this is not the only thing we consider. Other people might consider career growth. Other people might consider the workload involved. Many other people might consider employer switch, if that makes sense. So, I mean, being able to transfer between one employer and the other, if that is easily done or if that can be achieved. So in some settings you're expected to do a whole bunch of things, while in other settings you're expected to do less of that. Other people might consider interprofessional engagement. However, in this video I'll be talking just about one or two of those points I mentioned, because it's a lot of them. So I might be having two parts of this video. Maybe next time I'll be elaborating more on other points I mentioned before. You might not 100% believe or agree to what I have to say in this video, but you're free to comment on the comment section to tell me what you think, or your experience, or what you felt, or anything you think actually. So 100% you might not believe, you might not agree, but this is based on my own experience. So when it comes to career growth, it involves a whole lot of things. It entails so many things that you can imagine, and even those you can't imagine. One thing is for sure, career growth involves personal and professional development. Anywhere you are, you would like to develop personally and you would like to develop professionally. This is natural, this is just there. Secondly, it involves being able to get professional, impartial career growth and advice. It involves being able to study maybe master's degree, being able to go into other roles and everything. So it really involves a whole lot of things. When it comes to career growth, you might choose to take extra responsibility on the area you are, or you might choose to move to different area. You might choose to be a different, maybe you were let's say a stroke nurse. You might choose to, oh no, I don't want to be a stroke nurse anymore. I want to be a pain relief nurse. I want to be a resuscitation nurse. I want to be a diabetic nurse. You can all do this in NHS hospital, but you can't do all this in a care home. In the NHS hospitals, career framework has been designed to improve career development. Okay, so be it a nurse, be it a doctor, be it a physiotherapist, be it a speech and language therapist, anything you are, any job role you're undertaking in NHS hospital, the career framework is already been designed. It encourages individuals to learn new skills. As we all know, we want to learn new skills at any point in time. So and all of this can be achieved in the hospital. All of this can be achieved when you are an employee in NHS hospital. However, it can be achieved in the care homes. I have a friend who has been working in the care home for the past 10 years, and currently she's still doing that exact thing she does where she first started. Like, she basically told me that they give medications, they make sure the patients are safe and all of that. Like, you do not have that opportunity to, you don't even have it at all. Talk more of exploring it. Okay, so make sure you get all the necessary information needed before you choose to work in the hospital or to work in the care home. However, the success to career progression often depends largely on adopting a proactive approach. So you have to make yourself available, you have to bring yourself out there, explore opportunities, ask questions, try to associate with people to know what is happening. Sometimes you might not wait for opportunities to fall into your lap. Sometimes you have to create your own opportunity. When it comes to job role, it involves what you are expected to do. Your job role as a nurse in the hospital increases your horizon, but that same job role in the care home might not increase your horizon as you wish. So when it comes to job role in the hospital in a day, you do not know what you're going to have, you do not know what you're expecting, nothing is sure. Whereas in the care home, you already know who you have, you already know the patients or the residents you've got. So one of my friends was telling me that a patient has been in her care home for the past 10 years, and believe me, when you have this type of patients or residents, you already know what you're doing, you already know the medications you're giving to them. But in the hospital, it is a total different ball game. So you can come to the hospital in a day, and that same day you might have a catheter to put, you might have a cannula to insert, you might have to do some bladder scan for a patient, you might have to do some ECG, you might have to send some patients to theater, you might have to do some wound dressing, like a whole bunch of things. At handover, you have to prioritize what to do first. So let's say Mr. A is having increased heart rate and Mr. B has a wound dressing to be done. You have to prioritize. This is where critical thinking comes in. So you have to think, tell yourself, this is what I have to do first before this. So you have to think at any point in time in the hospital, you have to prioritize what to do. So care home is basically where people who have long-term illnesses are taken to be looked after. So you do not have that arena to jump into another job role or to maybe be a diabetic nurse or something like that. It's good this is made clear to everyone. So if you want to choose between working in a care home or in the hospital, you will have that all the idea you need to be able to choose. So I am not saying this to discourage anyone that would like to work in the care home. No, don't get me wrong. I'm trying to make it open, the difference between these two things. You have to think, you have to make your brain work. Okay, so I am not saying people that work in the care home doesn't make their brain work. Don't get me wrong. I'm not saying that they don't do critical thinking. Don't get me wrong. What I am saying is most of the things they do there in the care home is already planned, because the patients have got chronic conditions in the care home which has to be looked after. Me coming to work, I already know what I am going to do. This is different when you are working in the hospital. For instance, in the hospital, we have lots of acute patients, we have lots of acute cases. So a patient might have maybe diabetes, a patient might have high blood pressure, a patient might have tachycardia, and this same patient might have retention of wee and all of that. So you have many lots of things going through a patient. So you have to look after all these things. Just you have to prioritize what to do. It is very, very different when it comes to hospital and care home. However, everything I just mentioned here is from my experience. So someone's experience might be different. It depends on the ward you're working at. So feel free to tell me what you think in the comment section, and don't forget to leave a comment. Don't forget to tell me what it feels, how it is in your hospital or in your care home, or what you've been trying to know about hospitals and care home differences. Okay, so as I said earlier, in my next video I'll be talking about the remuneration, I'll be talking about the workload, I'll be talking about the other miscellaneous benefits, and hopefully I'll see you in the next video. Please do not forget to like, subscribe. Do not forget to share this video to whoever you think might benefit from it. For me, I've had lots of people ask me questions, especially the overseas nurses, about this particular topic, so I can share as much as possible as to people who I know, but you can as well share to other people. Okay, so that's all for this video. Hopefully I'll be seeing you guys next time. Thank you.